Let us now talk about pneumoconiosis, which, as we have mentioned earlier, is due to the inhalation of certain dusts, uh, which are chemical agents. Inhalation of those dusts may result in certain conditions known as pneumoconiosis. So, pneumoconiosis are a group of interstitial lung diseases which are caused by the inhalation of certain dusts and the lung tissues reaction to those dusts. So these are pneumoconiosis. The principal cause of the pneumoconiosis is workplace exposure. The exposure to certain chemical agents, which are dusts, results in pneumoconiosis. There is no other way pneumoconiosis may occur. It is only in certain occupations, in certain places where there is exposure to these dusts. Dust particles of size 0.5 to 3 micron are hazardous. The 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 dust particles which are bigger in size from 3 microns, those are not as hazardous as the ones which are lesser in size than 3 microns, because those become entrapped in nasopharynx and do not reach the lungs. And also the dust particles which are less than 0.5 micron in size are also now not responsible for pneumoconiosis, because they, when inhaled, are phagocytosed by the phagocytes. So development of pneumoconiosis is dependent upon chemical composition of dust, what kind of dust was that to which the worker was exposed. It also depends upon the fineness of the dust. As we have said earlier, the dust particles ranging from size 0.5 to 3 micron are responsible for the pneumoconiosis. It also is dependent upon concentration of dust in the air, how much dust was there, and also to the period of exposure, how long has the person been working in such hazardous environment, and also to on the health status of the person exposed. Was he immunologically compromised, or was he healthy, etc., or was he carrying any pre-existing disease, etc. There is no cure for pneumoconiosis. So here are some examples of pneumoconiosis. These include anthracosis, silicosis, asbestosis, siderosis, bagassosis, farmer's lung, Bagassosis, tobaccosis. So depending upon the type of dust that was responsible for the development of pneumoconiosis, these are certain varieties of pneumoconiosis. So the first example of pneumoconiosis that we have is silicosis, which is due to the inhalation of silica or dust containing silicon dioxide, and it usually happens in the occupations of mining for gold or mica, silver, coal, lead, zinc, or manganese. All these mines or mining for these substances include some silica dust to be inhaled and can result in silicosis. Then in pottery and ceramic industry, in sand blasting, in metal grinding, building and construction work, rock mining, iron and steel industry, all these involve exposure to silica dust. Incubation period may vary from few months to 6 years, and it causes eventually nodular fibrosis of lungs. Onset is with irritant cough, dyspnea, and chest pain. Silicosis also involves impairment of TLC in total lung capacity in advanced disease. Snowstorm appearance is seen on X-rays in case of silicosis, and silicotics, or the people who have silicosis, these are prone to superimposed tuberculosis. So tuberculosis develops secondarily and is superimposed on silicosis, and this results in silicotuberculosis. Substitution of substances that contain silica with some others, or complete enclosure of the points or of the places where the processes involving silica dust are going on, or isolation and hydroblasting instead of sandblasting, good housekeeping, personal protective measures, a regular physical examination of workers. These are some of the measures that can result in control of silicosis. It is a notifiable disease. So here is the X-ray picture of a person with silicosis, and you can see the snowstorm appearance on the X-ray. So the second example of fibrotic lung disease due to inhalation of some dusts or pneumoconiosis is anthracosis, and anthracosis is due to the inhalation of coal dust, and it occurs in coal miners, and it is caused by inhalation of carbon, and the development of anthracosis is dependent upon the amount of dust inhaled and duration of exposure to coal dust. There are two phases of disease. First, there is simple pneumoconiosis, and then there is progressive massive fibrosis. It is also a notifiable disease. So, coal workers pneumoconiosis, or anthracosis as it is known, is a black lung disease. It is caused by the inhalation of coal dust, and it is estimated that 5% of all coal miners are affected, and 2% of among those have scarring on the lungs, and it is the most severe form of the disease, that is pneumoconiosis. So as we said, that anthracosis has two stages. The first one is simple pneumoconiosis, and it usually appears after about 12 years of work exposure in a coal mine. It is generally asymptomatic and or starts with unproductive cough or dry cough, and it is associated with little ventilatory impairment initially. Pathologically, there is formation of dust macules in the upper zones of lungs. There may be fibrous nodules that may appear after some time, and there may be focal emphysema. On X-ray chest, there will be small, ill-defined opacities in the middle and upper zones. Here you can see the X-ray picture of a person with anthracosis when there are opacities in the upper and the middle zones of the lungs. The second stage in anthracosis is progressive massive fibrosis. In this stage, there is cough with jet black sputum. There are wheezes and rhonchi. Trachea may be displaced by lesions in the upper zone. There is a severe respiratory disability. There is Kaplan's syndrome, which has rheumatoid arthritis associated with pneumoconiosis. The X-ray chest shows multiple opacities with cavitation, and there is calcification of hilar lymph nodes, and it usually results into premature death. There is no cure for it. The third example of pneumoconiosis is asbestosis. Asbestosis is also a progressive disease which involves scarring of lung tissue as a result of exposure to the microscopic fibers of asbestos. And asbestos are fibrous mineral silicates usually, which are encountered in certain occupations. Asbestos can withstand heat and has insulating properties. Usually the asbestosis occurs in the occupations of asbestos, cement manufacturing, or fireproof textiles, or floor and roof tiles, brake pads, and clutch plates. So inhalation of asbestos in the occupations that we have just mentioned may result in development of asbestosis as well as hyaline pleural plaque formation. There may occur a malignant mesothelioma, and there is a strong association of pleural carcinomas with the crocidolite varieties of asbestos, and it usually appears after 5 to 10 years of exposure to asbestos. Bronchial carcinoma may develop in addition to pleural or peritoneal carcinoma. So, and cancer of GITs are also associated with exposure to asbestos. Clinically, there is dyspnea, which is frequently out of proportion to the clinical signs in the lungs. In advanced cases, there may be clubbing of fingers, cardiac distress, and cyanosis. Sputum shows asbestos bodies, which are asbestos fibers coated with fibrin. On X-ray chest, there is ground glass appearance in asbestosis. So here is an X-ray chest of a person with asbestosis showing ground glass opacities. Another type of pneumoconiosis is Bagassosis. It is caused by the inhalation of sugarcane dust or bagasse, cane sugar industry or manufacture of paper or manufacture of cardboard and rayon where cane fiber is used. These are the occupations where there are incident where there is incidence of Bagassosis. Thermophilic actinomycete is a microorganism that develops or that is present on sugarcane dust or bagasse, and this results in or it acts as a biological agent for development of Bagassosis. The symptoms of Bagassosis involve breathlessness, cough, hemoptysis, and slight fever due to acute diffuse bronchiolitis. Mottling in lungs is seen on radiography. Pulmonary function is impaired. Another variety of pneumoconiosis is viscinosis, and it occurs due to inhalation of cotton fiber dust over long periods of time. It is a disease of textile industry workers, and a reported incidence of 7 to 8% among all textile industry workers. The clinical picture involves cough and tightness in chest. There is Monday morning fever, that is after a day off. The person may experience fever and fatigue before going to work. There is progressive dyspnea, chronic bronchitis, and emphysema. Another example of pneumoconiosis is farmer's lung, and it is caused by inhalation of moldy hay or grain dust. The causative agent is another thermophilic actinomycete, an organism which grows rapidly in grain dust or hay due to its moisture content. Clinical picture involves general and respiratory symptoms, physical signs, repeated attacks cause pulmonary fibrosis, and eventually there may be cor pulmonale